Good afternoon, and thank you for joining me today. As you can see, I'm here today without the county executive. He is meeting with President Biden this afternoon and sends his regrets. He will join me again next week. Case counts in Allegheny County continued to increase this week. According to the state early warning dashboard, Allegheny County's 7-day rolling positivity rate increased to 7.7% from last week's 6%. The rolling daily case count has also increased significantly, with an average of over 400 cases per day if you include both confirmed and probable cases. Hospitalizations started to increase at the end of February and have climbed about 10 additional hospitalizations per week since then. Sadly, we again have more than 100 county residents hospitalized with COVID per week. From our case investigations, we know that people are gathering in large and small groups, often without masks. We've noted a significant rise in people ignoring mitigation strategies. When coupled with more variant cases, we have the foundation for a surge, which is borne out in our case counts this week. We are now back to where we were in mid-January. We continue to monitor outbreaks in the community, which have changed over the past few months. While over 70% of outbreak cases in 2020 were in long-term care facilities, that has declined to about 15%, due in large part to the vaccination efforts. Currently, there are outbreaks among high school and college sports, small and large events, workplaces, and others. There's an outbreak associated with a large party among children outside of school at which there was apparently no social distancing or mask wearing. Unfortunately, an elementary school had to make a decision to close in accordance with the Pennsylvania Department of Education guidance. Short of everyone being vaccinated, we are all working as hard as we can to accomplish that. The only way this pandemic will subside is if we all adhere to the tried and true mitigation strategies of face masking, keeping physically distant, and limiting the size of social gatherings. Not all the news is bad. Despite the surge, we continue to make progress on vaccinations. As of late last week, more than 70% of county residents aged 65 and older had received at least their first vaccine dose. This is extremely important. We know that over 90% of those in our county who died of COVID-19 were in that age group. And I'm also pleased to share that over 40% of residents aged 50 to 64 had also received at least one vaccine by the end of last week. As a reminder, the health department is one of many vaccine providers in the county. We have received and administered about 10% of the vaccine in Allegheny County. We continue to monitor the distribution of vaccines with the goal of equity, and we will continue to work to get our vaccines to all those in need. Of the more than 65,000 doses we at the health department have administered to county residents, 18% have gone to those who self-identify as not white alone. We are currently operating clinics at Castle Shannon Volunteer Fire Department, Central Baptist Church in the Hill District, and the Ross Community Center. We have signed an agreement with a location in McKeesport and are finalizing staffing arrangements. We plan to open appointments there late next week, so please stay tuned. As we move past the initial wave of demand for vaccines, we must work to reach even those who may be hesitant. I'm pleased to announce a new messaging campaign, United Against COVID, Spread the Truth, Not COVID. About 5 months ago, the health department engaged MEE Productions and a group of community leaders to work together to develop COVID and vaccination communication strategies. The result is a great collection of educational videos, print and digital materials, and ongoing training and assistance to effectively use these assets. The materials were developed by community leaders and will be shared and promoted by community leaders. We understand the reach and credibility community organizations have and are glad to be partnering with the trusted communicators to advance the work of keeping residents safe and promoting vaccinations. I am thankful to all who have and will participate in this work. Another important change this week, the soft launch of a new vaccination registration system. We are currently using this tool internally for our clinics. Good news, it's easier to use both for the vaccination team and the public. It's more intuitive and flexible. Most significantly, when it is available to the public, the new system allows those who would like to receive a vaccine to register, and when you're eligible based on state criteria and we have vaccine available, you will be invited to schedule a visit. We expect to announce by the end of the week when the new registration site will be open to the general public. A press release and Allegheny alerts will provide the web address, which will also be posted on all of the COVID information pages on our website. Speaking of eligibility, Secretary Beam today announced changes to vaccine eligibility. To be clear, these dates mark when you're eligible to schedule a visit, not that you will get a vaccine starting that date. Effective today, Pennsylvania expanded vaccination eligibility to include Phase 1B targeted populations, including law enforcement, firefighters, grocery store workers, and those who work in food and agricultural manufacturing. On April 5th, the eligibility will open to all Phase 1B, on April 12th to all Phase 1C, and on April 19th to all Pennsylvanians. I encourage county residents who would like to get a vaccine to register in our system when it opens to the public, regardless of what vaccine phase you're eligible for. Just a few reminders. Testing remains an essential way to control the spread of the virus. We continue to have free testing available. If you have symptoms, please get tested and stay apart from others until your results come back. If the health department calls you, please respond and identify your close contacts so we continue to restrain the virus from spreading. Finally, if you are one of the lucky ones who has already been fully vaccinated, please take care of those around you who are not. And remember to wear your mask when out and about, practice physical distancing, and follow other prevention measures, especially when visiting unvaccinated people or out in public. Thank you for your time. Please stay safe and be kind.
We have just a few questions today. The first is from WTAE. Cases have apparently been rising in Allegheny County, but the state is still planning to loosen restrictions on Sunday. Will Allegheny County be doing anything different or sticking with the state's plan?
So, as you recall, the purpose of our mitigation strategies when this all started was to really, a number of things. One is really to protect those most vulnerable, those 65 and older. And as I reported, we've actually done a great job at getting that population vaccinated. It also was to protect our healthcare infrastructure to make sure we didn't overload the system. And so the reasons for mitigation strategies change over time, and we have to keep that all in mind as we plan for the future.
And this final question from WPSI. There have been rising cases of COVID at the University of Pittsburgh. In light of the measures taken by Pitt earlier today advising students to shelter in place beginning tonight, do you have concerns about Pitt or the other nearby universities?
So as I've been reporting for the last few weeks, we have seen widespread community spread of the virus. And our cases are on the rise, not just at Pitt, but across the county. And so people just need to follow the advice of what I've just said in my comments, continue to wear their mask, limit gatherings. I know this is Easter weekend and other holidays this weekend, and I encourage people to really keep your meetings groupings small, wear your mask, sit outside if you can, and really be careful because our cases are spreading, not just on college campuses, but across the entire county.
That was the final question.
Okay.
Do you have any closing remarks?
I don't, but thank you all for joining us again. See you next week.
Our next